Hello, brain shakers. So we continue looking at the physiological changes that are happening during the stage of pregnancy, and today we're looking at some of those changes that happen within the reproductive tract. Now, within the reproductive tract, we know that the stage or the process and physiology of menstruation is a normal process that should then happen, but there comes a time when pregnancy has been achieved and the process of menstruation then has to cease. Why? Because there's still going to be the presence of progesterone and estrogen into the system circulating and not allowing the process of menstruation to then happen, because it only happens when there is a decline in the progesterone and estrogen hormones to levels that the uterine lining cannot and can no longer be protected, and so that stratum functionalis will then have to shed. But when pregnancy has then been achieved, then amenorrhea comes in, which is a state where you don't get to see your menses. And in most cases, when one does not see their menses, especially if they are in the age that is sexually active, then they would be suspecting a pregnancy. Now, in pregnancy, obviously you have amenorrhea because there's no way your uterus will be shedding whilst it's preparing to get that fetus to come in and be nurtured and grow or develop within its environment. So what then happens is the uterus also will have to make some adaptations or changes in its dimensions, in its volume, and also in its position, or rather location. So we know that the uterus is going to change in terms of its dimension, that is the length, the breadth, and the width, from about 7.5 by 5 by 2.5 centimeters to about 30 by 23 by 20 centimeters. So that is a massive increase in terms of its length, in terms of its breadth, and the width as well. And also you will notice that the uterus is then going to increase from about 6 mils of volume to about 500 mils of volume. That means that you now have adequate space within it to then accommodate this growing fetus. Now, the uterus during its pre-gravid state is around about 50 grams or so, but then when it gets pregnant, it then increases to about 900 to about 1,000 grams. So that is an increase in its weight as well. And around the 12th week, we know that the uterus would still have been within the pelvis, but at the 12th week of gestation, the uterus would then leave the pelvis and come into the abdominal region so that it can continue now to grow forward, because there is no bony restrictions within the anterior aspect of the abdomen. Then by the 36th week or so, it would have reached the height of the xiphi sternum, which is just the lower portion of the sternum, which is just the part that divides your rib cage into the left and the right. So those changes that are happening within the uterus, even the blood supply as well that comes to the uterus, then increases, because the uterus is now going to have a lot of work to do. The muscles that are there, which are the circular, the longitudinal, and the oblique muscles, also will now become more differentiated after they have undergone hypertrophy, and then they get into a stage of hyperplasia where they begin to work even a little bit more. So the circular muscles that are there will then be responsible for the opening of the cervix during the stage of labor, because you will find them around the corner of the uterus and also around the cervical region. Then you have the oblique muscles that kind of cross the uterus, and these ones are responsible for expelling the fetus when the woman then gets to a stage of labor. Then you also have the longitudinal muscles. Now, the longitudinal muscles play a key role in making sure that they then contract and retract to make sure that the upper segment of the uterus then thickens, and then during that process there will be a reduction of the intrauterine pressure, or there will be an increase in the intrauterine pressure, whilst the volume in the intrauterine pressure reduces, and that pushes then the fetus into the lower segment to then continue the process of opening the cervix. So basically that's what's happening in the reproductive tract, and that's during the stages of pregnancy as you move all the way until labor. Around the 6th to 80th week, the uterus may also generate some simple wave-like contractions, which you call the Braxton Hicks contractions. They are different from labor contractions, and these are, in most cases, painless kind of contractions. And if they get to a stage where they are painful, they may not need serious treatment. Just amount of rest and hydration may be able to make them stable. So basically that's what's happening in the reproductive tract, and we continue looking at the changes that happen during the stage of pregnancy. So do make sure to subscribe to our YouTube channel, which is the Brain Shakers Academy. Follow me on Facebook as well, the Brain Shakers Academy. Drop me comments in the comments section, and I will see you in the next one.